last time I taught this class, I taught a lot more of the biology, physiology of even like pregnancy and things like that. But in order to make this class much more about the psychology of sexuality specifically, I've taken a lot of the things that you can just read on your own, the physiology of different things and anatomy. Your book is very good at being able to talk about those sort of things, but an effort for us to go into more detail into like the chapter on gender or orientation or love and things like that, to give those more of a spotlight, I've taken less of the biology and physiology out of it. Now, I have kept, what happens physiologically in reaction to psychological type things. So, like, how is arousal related to psychology, and what happens physiologically when we're aroused in that way. So that's kind of how I did that. Alright, so hopefully some of you have heard of Eve Ensler. She's very interesting, very cool lady, and she went around, I'm not sure how long ago, at least 10 years ago, and she's probably updated her stuff on this, but went around and interviewed women about how they felt about their genitalia. And, obviously, as you can tell, I'm a man, so it's hard for me necessarily to really fully understand all of, what it means to be a woman as far as anatomy and physiology goes. But nonetheless, we still have this material to cover, and I'll try to do my best. But as I was saying, Eve Ensler, she goes around and interviews many women all over America, gets a very diverse cultural sample and things like that, and talks to them about how they feel about their genitalia. And she found that people are kind of hesitant. Women are hesitant at the beginning about talking about how they feel about their vaginas, but then as the interview goes on, it's like they opened a box, and it's like, oh my gosh, I'm so glad I get to finally talk about my vagina and how I feel about it and what I was taught about it and things like that. So check out this YouTube video. It's kind of like a clip, a few minutes of what she did and why she went about that. I don't think she's necessarily like a scientist per se, but she did do us a justice for women as far as that goes. So that's just kind of our, general attitudes in our society towards vaginas. So we'll talk about female physiology and arousal. So obviously arousal can occur physically. It can be argued whether there's always a physical and a psychological component that come together to produce arousal. So we'll focus mostly on psychologically what is arousing. So like it's very easy to think about, this may be more so for men than for women, but being visually stimulated by something that's arousing, there's a process obviously that goes on in the brain, psychologically related, and then there's physiological responses to being aroused as far as that goes. So what happens when women are aroused? So we'll look over at this side. So this is normal versus aroused, and we'll see that the capillaries engorge the lacunar spaces. So we see arousal here, the blood engorging into these areas. So that's why you would see swelling in this area during arousal. And then as far as lubrication, so you have the engorgement from blood and then the lubrication as well. So this is normal without arousal. And then you have the capillaries here contributing to the lubrication of the this side right here, the vaginal lumen. And so we'll talk a little bit about, how what are ways that happens. So one of the ways that women are aroused is through clitoral stimulation. A lot of people underestimate how important it is so like I said, this isn't just physical, it's like not just physical stimulation of the clitoris is necessarily going to lead to arousal or orgasm, but it may be, feeling safe with a partner, or, if there's a type of pornography or fantasy that's very stimulating to the person, but stimulating the clitoris in conjunction with all that can lead to arousal and orgasm. And another way for stimulation could be people have heard about the Grafenberg spot. The G spot is another way to stimulate. Women are stimulated. See the pressure being put right there against the wall right there and kind of up. And many women report different types of feelings of orgasms from this type of stimulation. And then obviously the breasts are important as far as stimulation goes as well. As far as just women, most studies have found that about 80% of women find stimulation of their breasts to be stimulating, and then about 50% of men said the same thing as well. So that's kind of like a very condensed version of what I want us to kind of remember and build upon for later, like when we touch on the chapter on arousal and response, just to bear these things in mind, the way that physically may arouse a woman. And obviously there are more ways than just these physical things, like through the G-spot, through the clitoris. A woman may be aroused without any physical stimulation, but that's when, orgasm comes into play. So when you have that physical with a psychological arousal, that could lead to orgasm, or it could just be all physical. It depends on the person. So I'll talk a bit about menstruation and our attitudes in society about that. Doctors, physicians, and whatnot pronounce it menstruation. I rarely ever hear anyone pronounce it that way, but that is apparently the proper way to pronounce it according to your book. So what is menstruation? Sloughing off of the uterine lining if conception hasn't occurred. And a lot of people in our society have a lot of embarrassment and shame about menstruation. A lot of women aren't ashamed or embarrassed, which is good, but then a lot of people are. There's a good video down here about which kind of interviews a lot of women on how they felt about when they first menstruated, menarche, and what they were taught as far as menstruation goes, and about blood and things like that, how they felt about their bodies. So that's a good video. Sexual activity and the menstrual cycle. So you see here, this is the around 30-day period that women ovulate right here, and then menstruation would be around 5 days long. So that cycle of going through the fertility window there. And so important for us about what we're just about to talk about is the most fertile days being around ovulation. So ovulation, if you're unfamiliar, is when an egg is released from the ovaries in the woman into the fallopian tubes, where the sperm may meet it and conception or pregnancy occurs. So the most fertile day for women, oftentimes their sexual desire is increased here. So this is where we get into the psychology of the menstrual cycle. And there have been a lot of interesting studies that have been done on sexual desire and the menstrual cycle, especially when it comes to ovulation. So you can see here Shirazi and others in 2018. There's been done, studies have been done before that as well, showing that around ovulation, greater sexual desire for women at this time. Scientists have also found that women tend to flirt more during this time, which is kind of interesting, looking at like a behavioral sort of manifestation of sexual interest arising. So one of the studies that's in our book that's really interesting is a researcher went and studied lap dancers, and I know it sounds a bit intrusive, but asked questions about their menstrual cycle, found out when they're ovulating and things like that. And they showed that the women who, during ovulation, like we were just talking about, during around this time right here, when the women are most fertile, most likely to be successfully impregnated, they got more money. So that obviously led the researchers to theorize, why is it that a lap dancer would earn more money when she's ovulating than other times. So I think the interpretation of that data was that the women during ovulation were more flirtatious and things like that, and so they got more money during that time. So it's a really interesting study there that they did. Check that out in your book for the reference on that study. So let's talk about sexual activity and the menstrual cycle. I know a lot of people may be comfortable, uncomfortable having intercourse when menstruating, but according to your book, there are no health reasons necessarily to not engage in that sort of activity during that time of the month. But research shows that a lot of people choose not to have sex during that time. But as far as physiologically it goes, there's no danger there. Tanfer and Arnold, this was a little dated as far as research goes, but they found that the prevalence of women who have intercourse when they're menstruating is about 25%. And of course, if you're menstruating and don't feel comfortable having intercourse during that time, there are plenty of other options of things that you could do. All right, so I took different sections from chapter 3 and check your syllabus to see the page numbers that I decided are more psychologically relevant. So that chapter 3 and 4 are a couple of the chapters that I just took specific information from. So the next part of information from chapter 3 that I wanted to bring to everybody's attention was female genital mutilation. Now, it's hard to come from an outside perspective. Largely this isn't practiced, obviously, in America or Western Europe, much more in Africa and in other countries. So, I want us to be careful in going into this topic of saying female genital cutting or mutilation is wrong in a human rights issue. That's the position that the book takes, which, I agree with. But still, trying to understand this is good to do. Kind of try to understand it objectively, even if we disagree with what it is. So let me get... So across 29 countries, people engage in this sort of thing, female genital cutting, some countries in the Middle East. And so it's approximately 125 million girls and women in the world who have experienced this. So a lot of people, to do these procedures, use pretty crude sort of things to accomplish that. So like broken glass and razors and things like that. So the removal of the clitoris, which is obviously for trying to remove the sexual pleasure that the woman receives during sex. That's often incorporated into this, called clitoridectomy. And there's a lot of health consequences that occurs from female genital cutting. So urinary obstruction, intense pain, obviously, and many women die from these. It's not really a procedure, but thing that happens in some of these cultures. So the United Nations has said official statements about this, saying that that is going against the human rights of all these women who have the right to, say what they want to be done to their bodies. So check out this this YouTube video on it, and it'll give you more details if you're unfamiliar with this practice that's done. And then your book does a good job explaining this as well. And you may be wondering, like, why do they even do this? And in large part, the theory is that it's a control of female sexuality, saying that if basically, because there's no alternative as far as men goes, there's no, sort of procedure that happens to men where their penises are altered or cut off or anything like that. It's like this idea that women are in control of the sexuality and altering their genitals as a way to control their behavior. So we'll talk a little bit about menopause, the psychological effects of menopause. So menopause, transition from being fertile to infertile for women. So a term for this, the physiological changes that occur during this time, climacteric, and transition to menopause, perimenopause, and the final cessation of the actual menstruation, no more menstruation or fertility anymore, that is menopause. So as far as psychologically, why is this interesting for us? Well, there's a thing called hormone replacement therapy. Let me go to this point right here. Sorry, that's a little confusing, but look at this point right here. Treats symptoms associated with female menopause. So a lot of women experience hot flashes, so becoming very, very hot and uncomfortable. Also decreased muscle mass after menopause, bone loss, sexual dysfunction like lubrication and orgasm. A lot of different problems like that that is treated with hormone therapy. Also treating anxiety and depression that may happen because of menopause. Estrogen is the main treatment that's usually administered, and is kind of like this idea that there's a certain amount of estrogen that was healthy for the woman up until menopause, and then there's a sharp decrease in how much estrogen is available, but taking estrogen orally can continue that balance that the women had before. But there's a lot of controversy in hormone therapy. Whether, in large part, whether it's healthy. There's a lot of data showing that women suffer from either increased cancer risk and things like that. There's a lot of debate within the field of whether engaging in this hormone therapy is actually helpful or not, and there are risks involved. So it's a complicated decision for many women to think about, weighing the risks versus the benefits of hormone replacement therapy. So we'll stop there. I know it's a little cursory going through chapter 3 on those sort of topics and whatnot, and chapter 4 will kind of be like that too, a little bit more brief than other chapters that we're going to get into. So that is the third video of this week. And so male sexual anatomy and physiology. And that's what we're going to cover now. So we'll start with a little fun sex fact here. A little disturbing, but get your attention with this. You can break the penis. We're talking about vasocongestion a lot today, and which, if you don't know what I'm talking about, you will soon. And so we'll be talking about erections and lubrication and arousal in men and women. And a little known fact about the penis is that you actually can break it. No, there aren't any bones, but it's more of a rupture. I won't go into too many details, but this fibrous tissue right here around the very outside underneath the skin can actually rupture. So be careful out there. Yep. All right. So just to give a little bit of cultural context to the penis in our society, and not just to talk about the physical aspect of erections and things like that, let's look at a lot of classes look to the Greeks to kind of see, what was Western thinking, and does it influence Americans today or anything like that. But back in ancient Greece, there was this god Priapus who always had an erection. So you can kind of tell that society has been, I don't want to say obsessed necessarily, but has been very interested in male erections. And there's even a whole god just like devoted to that. So I think it's pretty interesting and really reflects on the society that they were interested for whatever reason in erections. And then little fact from that, his mother was Aphrodite, which, if you know much about Greek mythology and whatnot, she's one of the main goddesses within that pantheon, and she was the goddess of love and beauty. So you see some sort of connection there of her bearing a child that was the protector of male genitalia. So it seems as though the Greeks had this notion that erections have something to do with love itself, romantic love and things like that. Interesting food for thought. And then a lot of these, so here's some more kind of cultural, sociological sort of points to consider. As far as this guy from Greece here, there's just a lot of art throughout time that's featured erections. So I think what you can kind of take from that is that people have been interested in them throughout time. So, and then here is a YouTube video that I'm going to ask you guys to watch on the history of the penis in Western culture. So as far as just the general physical makeup of a penis, there are a lot of nerves in there, blood vessels, as you can see pictured here, fibrous tissue, and spongy tissue. Those are the main types of things that you'll find in there. For our purposes, that we're a little more interested in is this corpora cavernosa. So right here, and the next slide's going to picture it, I think, more clearly to me. Is really just this whole area here, let me know if my cursor doesn't show up on y'all's screen, because right now I'm highlighting the part of the penis that I'm talking about, so I want you guys to be able to see that. So this is a very important part, the corpora cavernosa, and then the corpus spongiosum, so down here where the urethra is, where guys pee out of. And so when we talk about the penis getting erect, both of these areas, this corpora cavernosa, look on the flaccid. See the flaccid side here? This side fills with blood during arousal, and you can see the erect penis over on your right. And so the blood fills those areas, fills that spongy tissue. And also down here as well, the corpus spongiosum. It fills with blood just like the corpora cavernosa as well. So that is like the most basic, like what is the penis made out of, and then what changes to it during arousal. So keep those things in mind. Okay, so this is a clearer picture of the corpus cavernosum. It's that whole area right here and right here. Interesting tidbit about sexual arousal, and this goes for women as well, is that the parasympathetic nervous system has to be activated. So I think a lot of you have heard about the sympathetic nervous system, so fear and running away or fighting, that high physiological sort of state. When the sympathetic nervous system is activated and ongoing in your body and whatnot, it's almost physiologically impossible to engage in sex. Obviously, you can see evolutionarily why this would be advantageous. If you're in a dangerous situation, you don't really want to be having sex, by and large, most people. So in order to achieve sexual arousal and whatnot, people need to be relaxed. And so I've treated clients before who had difficulty achieving lubrication and things like that, general arousal, but they struggled a lot with anxiety. So that sympathetic nervous system was just so overactive that it was basically impossible to really go through the full process of like arousal and orgasm and things like that. And so technically, blood is always flowing to the penis and then coming out of it, exchange there. During the erection, as you can imagine, more blood is coming in than is coming out. So that explains the stiffness and how the erection maintains itself. Bet you guys are kind of glad that this is online asynchronous. If it's talking about this stuff in person can be embarrassing for some. Capacity for erection is present at birth, so it's not necessarily so, it's not just older men or men over 18 who necessarily get erections. Of course, sexuality in general changes from birth to much later in life, but as far as the physiological capacity or ability to have an erection, that's even present at birth. Not that there is any psychological, we'll talk about this, psychogenic arousal, so being sexually aroused by something in one's environment or a sexual fantasy and whatnot. That's not what that is. Here we go. Psychogenic and physiogenic erections. Typically, an erection usually will be psychogenic and physiogenic. So there'll be thoughts, fantasies, a partner, things like that that primarily, occur in the brain and mind and whatnot that lead to an erection, but also, as we'll talk about today later, touch and things like that actually stimulating physiologically the whole response, that can be an erection as well. So it can be both. So it can be psychogenic and physiogenic, like I explained, or it can just be psychogenic, so an erection with no physiological stimulation, and then at the same time there can be an erection just from the physiogenic, so physical stimulation without that mental component so much so. Let's talk about the most sensitive areas on a guy's penis. So, yet again, let me know if my cursor doesn't show up for you guys, or let me know that it does, just so I know for sure. I think it does because it's capturing my screen. But so the corona is like the lip here. Here's the tip of the penis, and then see the ridge here. A lot of nerve endings in the corona there, rim of the penile glands, and then frenulum right here, and this is a circumcised penis, by the way, also has a lot of nerve endings as far as arousal goes. Both areas are highly sensitive to touch. So touching those areas would be, would oftentimes lead to a physiogenic erection. Another fun random sex fact of the day. I know a lot of people joke about penis size and other parts of your body, like hands, feet, and blah blah blah, stuff like that. And people have actually studied that to see if that was true. It's not, as far as feet goes. There's no correlation between foot size and penis length. But other factors actually did correlate with penis size, and that's age, height, index finger length, but not the foot size. Just a little interesting tidbit there. More about penis size. Throughout history, a lot of people have kind of equated the larger the penis, the more sex drive that man has. As you can imagine, that's not necessarily true. That's not how it works, but it's a myth in our society. And it's kind of a debate whether the bigger the penis, the better for intercourse and arousal and whatnot, and that depends on the recipient. So a man having sex with another person, some may find it a very large penis arousing, but some may not, And as far as penile vaginal intercourse goes, your book will talk about how the first 2 inches of the vagina are the most sensitive. So really, if your penis is at least that long, then that would pleasure a woman in that way. Phalloplasty, you don't have to worry about that. Worry about thinking about that. Check this video out on penis size from the beginning to about minute 2:19. And so I thought this was interesting. I've never really talked to a person. I meant, a lot of people wouldn't talk about sexual dysfunctions and whatnot, but I've not really talked to anyone about this, so I've really only seen it in books. But I think this disorder, genital reaction syndrome, CORO, is pretty interesting. That it seems to be, your book talks about how it seems to be culture bound, so not that many like white American men necessarily struggle with this, but in other some Asian countries and whatnot, people report this phenomenon. And it's basically this irrational fear that one's penis is getting smaller and smaller and smaller, and the fear is that the penis will just disappear. And people have been thinking this and worried about this for a long time, thousands of years, but it's just based on anxiety and whatnot, and there's no evidence that genitals just, penises just kind of retract and stay away. Of course, with cold, penises will get smaller and whatnot, but they'll go back to regular size. So, it's just a mental disorder sort of thing. So as far as chapter 3 and 4, talked about female anatomy and physiology and cultural attitudes towards things like menstruation. And then we talked about male anatomy and physiology and some cultural attitudes about the penis and erections. So